this is actually my anatomy book from medical school. Why is that important? Because everything that we do in medicine and everything that we do in surgery is based on the human anatomy. And knowing the human anatomy, knowing the levels, the layers, the depths, how thick each layer is really important, especially in hair restoration procedures. So we do FUE, we also do FUT procedures. When we do an FUT procedure, for instance, we're removing a strip of scalp that includes the skin, which includes the epidermis and dermis, and what's called the subcutaneous fat, which is a thin layer of fat right underneath the skin. And that's where the hair follicles are, and just in that junction. Underneath the fat is another tougher layer. We call it the galea. Beneath the galea is the larger structures, the nerves, the arteries, the veins. We don't want to be there when we're doing an FUT hair transplant. So you want to make sure you're in the right level, you're in the right layer. That prevents injuries or long-lasting potential complications. So knowing the anatomy is extremely important when we do FUT procedures, also when we do FUE procedures, knowing where we are. And also when you're creating recipient sites to implant the grafts, you want to know how deep you are, the depth of the follicles that you're being placed, so the different layers of anatomy, the thickness of the skin, all those are very important when we're doing hair restoration procedures, as they are in every other surgical procedure that's being performed. So anatomy is important when you learn it, and it's always important to retain it. The knowledge is important, and it's executed every day when we're doing these procedures.